Good evening. Thank you for joining us for the COVID community meeting for April 9th, 2020. My name is Brian Wheeler from Public Health. Tonight I am joined by panelists from Mono County, the town of Mammoth Lakes, Mono County Health Department, and Mammoth Hospital, among others. Tonight's format, as you can tell, is all virtual. There will be no one actually at a meeting site, so this is our first time attempting this, and we hope it goes well. The format is we will have the panelists speak, and then we will then proceed to the question and answer segment. So I first want to introduce our first panelist is the Mono County CAO, Bob Lawton. Bob, are you on the line?
Indeed, I am, Brian, and thanks very much. Good evening, folks. My name is Bob Lawton. I'm the acting county administrative officer for Mono County. I represent all of the staff and tonight the Board of Supervisors in an effort to respond to your questions and make notes for further meetings. And I will say that my 20 years in local government, many of which have been spent here in California, this is the most challenging set of circumstances we've run across, as I'm sure everyone's aware. But I do want people to be assured that county government serves the residents of the entire county, from Colville to Convict Lake to Crowley, and every place in between, and a little bit north and south. So, Brian, thanks so much, and I'm going to get out of the way and let the other panelists go to work. Thank you.
Thank you very much, Bob. Our next panelist will be our incident command leader, Frank Freebo. Frank?
So trying to find the buttons there. Thank you, Brian. Good evening, everyone. I'll keep this short. I know we have a lot of questions to move on to. Essentially, my role as the EOC director is to work on behalf of Bob Lawton, acting county CAO, Dan Holler, town manager for town of Mammoth Lakes, and Dr. Boo, our medical officer. It's been really rewarding to work with a wide range of people on this. Tremendous amount of commitment and long days, but as Bob said, it's about trying to focus on things from one end of our county to the other. A lot of various needs out there. Essentially, where we're at this point, we have fully equipped our ability to handle surge if we have that in terms of patients. The hospital's done a fantastic job. I was on the phone earlier with Tom Parker, the administrator there, and we work regularly with several of the doctors from both his staff and his incident command management team there. So I feel confident that we're ready to take any next steps, and I'll turn that over to your next panelist.
Thank you, Frank. Our next panelist will be the County Health Officer, Dr. Thomas Boo.
Good evening, everyone. Tom Boo, Mono County Public Health. And I just want to applaud everyone for doing this as well as we are as a community at distancing ourselves, at staying at home. It's really important, and I think that we are starting to see some effects, some benefits of that. It's been quite a quiet week. We're going on almost a week without any new cases. There was a case added to our tally that was actually from a few weeks ago, originally associated with another county. And I really just want to, I don't want to say too much now, just leave time for questions, but I do want to make sure that everybody's aware that our nurse phone line is operational. It can be accessed either through the 211 line or by calling the health department. And it's currently staffed from 8 a.m. to 5 p.m. Currently, the call volume is such that there's one nurse on duty. We can increase that as needed, but it's the best way to get information about your health if you're concerned about having COVID-19. And it's also the best way to access testing. Testing is becoming more available here in Mono County. It's still not as widely available as we'd like, and not everyone who wants a test will be able to have a test, but the hospital is able to do more tests now than before, and the nurse phone line is the best way to access that. Look forward to answering some questions. Take care.
Thank you, Dr. Boo. Our next panelist from the town of Mammoth Lakes, Dan Holler.
Thank you, Brian, and good evening. My name is Dan Holland, the town manager for the town of Mammoth Lakes. This has been quite a few weeks of response as we worked through a number of different elements and trying to get measured steps and getting in front of this virus that was sweeping into our community. A lot of effort has been put in it, and as was mentioned, I believe we are seeing a little bit of a slowdown in terms of the spread, but we are not out of the woods yet. Lots more work to be done, a lot of efforts being made by lots of people in response to not just the disease itself, but the impact it's having in our community as we reach out to those who have been impacted with job losses or other impacts, and really trying to lift people up where we can, try to meet their needs, and we'll continue to do so. And we really look forward to continuing that work. And thank you for participating this evening, and to all those who have donated, who have given their time and effort to be a part of this and to help, one, make these conversations happen, but better than that, really stepping out and helping their neighbors and friends. Thank you very much.
Thank you, Dan. Our next panelist, Mono County Sheriff Ingrid Braun. Ingrid?
Sorry, I had to unmute and put the video on. I'm just here to answer any questions that anybody has regarding what law enforcement response is in supporting the battle against the spread of the COVID virus. So thank you everybody for all their hard work. I'm especially proud of Mono County and how well we've done in limiting how much we move around. We're doing a really good job, and I'm very proud of our community.
Thank you, Sheriff Braun. Our next panelist is Robin Robertson from Mono County Behavioral Health. Robin?
Hi there, my name is Robin from Mono County Behavioral Health, and thank you all for joining us. Just want to make sure everybody knows that we have a 7 a.m. to 7 p.m., 7 days a week, the Lucky Sevens warm line available for you if you want support. This is a really hard time. You're doing a fantastic job. We're so excited about the levels that we're keeping down, and we have a lot of work still to go. In order to do that work, I think managing anxiety and the stress of all of this is really helpful. So do call us if you need us. And I'm here also to answer any kinds of questions.
Thank you, Robin. Our next panelist from Mammoth Hospital, Dr. Craig Burrows. Dr. Burrows, are you on the line?
I am. Thank you, Brian. So I'm Craig Burrows. I'm the Chief Medical Officer at Mammoth Hospital. And I'd like to let everyone know that because of all the efforts that everyone is currently undertaking, our hospital is not overwhelmed as we had feared we could become. We are able to admit patients and take care of people. From an outpatient perspective right now, our clinics are operating with a lot of telemedicine. So please don't be afraid to utilize that to maintain your health. As much as we're all concerned about coronavirus right now, we also have to be concerned about our chronic conditions that we're all dealing with that need maintenance, because if we ignore those for long enough, those are going to come up and bite us as well. As Dr. Boo mentioned, we are expanding our ability to do testing. We hope to have an in-house test available, hopefully by maybe the middle of this month, which will allow us to run tests and have a result back inside of an hour, which will allow us to better manage patients that we're concerned about that may have been exposed or infected, and then make decisions that allow us to take better care of everybody.
Thank you, Dr. Craig. So before we move on to questions and answers, this is a new format for us, so I just wanted to make sure that I didn't miss any panelists because I don't have them here in the room with me. Did I miss anyone tonight? It doesn't sound like I did. So let's go right ahead and get into the question and answer portion.
First question, what is Caltrans reply on closure of 203?
You want to repeat the question?
That sounds like a question for me. What is Caltrans' reply to the closure on 203? We haven't had an official reply from Caltrans on closing 203, and we're not going to be able to close 203. That would not happen. That would create essentially what they call a quarantine out, keeping people out of Mammoth Lakes, and we can't do that. We have a lot of communities that survive by coming to Mammoth Lakes to buy their groceries, do their essential business, people who work here. So we can't close any highways. We have asked for permission to do a checkpoint. I don't see that happening. We don't have any data to back that up. In fact, Caltrans has noted that traffic on 203 is down about 50 to 70% from this time last year. So we really have done a good job of keeping people out and getting our messaging out that we don't want people to travel here, but we don't expect an answer from Caltrans, and we don't expect to be able to do a checkpoint on 203 or anywhere else for that matter.
Thank you, Sheriff Braun. Next
Brian,
question.
can I add to that?
Absolutely.
So as Sheriff Braun mentioned, we really, I think, moved away from the idea of closing the road. Our message has really become much more, please understand what we're all dealing with and why we're asking you to stay away or not travel. And I think that's been largely successful, as everyone can attest to. It's been very quiet. There hasn't been a lot of traffic. And I think people doing their social responsibility to respect what we're asking has gone a long way. And it's a much better way to achieve what we want, I think, than being punitive or setting up some sort of barrier that makes people feel like they're not allowed to be here. And ultimately, when this is all said and done, we're going to want people to come back. So we're not going to want to feel like we're closing them out right now. And like I said, I think we feel like we're succeeding and we're achieving what we want to achieve.
Thank you, Dr. Burrows. Thank you, Sheriff Braun. Next question, please.
Can we please require customers of the stores and post office to wear masks? Other places are mandating it. We have to protect our workers, right? No mask, no service, we can say it. I got coughed on twice this week by customers without masks.
Dan Holler, do you want to take that one?
Sure, thanks. We are actually pushing really hard in terms of suggesting that everybody mask up. They have some type of face cover when they go out in public. We have not gone to the point of a mandatory requirement for mask wearing at this point. Part of that is just availability of decent masks to be able to provide. A lot of masks that are out there are like a surgical mask or something of that nature, which are inexpensive, but they're very short term in their use, so it takes a lot of them. The other side of buying good masks, they're just hard to get a hold of. We are working on having people sew masks. We're doing some handouts that way, trying to make sure more masks are available in the community. But at this point, if we actually did a mandatory mask or face covering, it would be really hard to enforce it. Secondly, to actually supply masks or provide those out there under a mandatory requirement. We can't encourage it, strongly recommend it. It keeps both you and I safer. And as you go into some of the stores, there may be opportunities, even working with store owners, to have a mask there and ask them if they come in without one for a $2 donation. Here's your mask, please keep us safe. So there may be some creative ways to really enhance people's desire to wear a mask and that social pressure to do so. And it really is, I think, one of those things that we should step it up. Like Dr. Craig's comment, Burrows, on the social responsibility. We need to be respectful of each other. And one way to do that is to wear a mask. I should say a face covering.
Thank you, Dan. Would anyone else like to speak to this question?
I think as Dan mentioned, this is really, it comes down to, I'm going to take care of you and you're going to take care of me. And the more we collectively do that, the more successful we're going to be in preventing this from spreading, or limiting the spread, I should say, and allowing us to all be healthy and get through this. So mandates, sure, you can do that. Nations like China have been more successful because that's the way China is set up for the most part. In the United States, I don't know that we have that luxury. but I'd like to feel like as citizens of this country, we all understand and appreciate what we have to do to get us all moving forward.
Thank you, Doctor. Anyone else? Okay, let's go to the next question then.
Seeing groups of kids at the Crowley store and the Shell Martin Mammoth meeting up and greeting each other, even with hugs. I heard that Douglas County, Nevada is issuing citations to kids under 18 that are out and about, following up with a citation to the parents. Is this something that can be done here?
Dan, I think that might be yours again.
I'll take a shot at it. Yeah, I'm not sure what they're doing in Nevada on that with the Douglas County side. And again, it's back to that pressuring to do that. The groups are out there, they do show up. We see some of that as we're out and about. One thing to do is, again, kind of, I'll say responsible adults or other kids that are around them, other young people, is to remind them, say, hey, you know, that type of behavior can actually cause you or your friend harm. Back to that kind of a social pressure element. We have not gone to the point of being able, I don't believe, to issue citations under that type of order. It's a gathering together and those types of elements and social distancing requirements. But to actually enforce that with the citation, I defer to Sheriff Braun on that. I'm not sure we have that authority in the current orders to do that, but definitely reminding people, calling them out when they're behaving badly, frankly, in this environment is probably a good thing to do. Do it nicely, you can do it respectfully, but remind people for their own safety and safety of others that behavior of the gathering together, the hugging, the touching, etc., in those environments are potentially spreading disease.
Thank you, Dan.
And if I may, Brian, from a law enforcement perspective, we certainly could issue citations. There are codes that we could issue citations for. It's a misdemeanor. But what we're looking for is voluntary compliance, an education piece to tell people what the orders are, why they're doing what they're doing is wrong and hazardous, and to encourage them to stop that behavior. So we could issue citations. We don't want to issue citations. We're not looking to make this harder on people by giving them a financial penalty or a criminal penalty, but to educate them and make them aware of what the orders are and why the orders are. And that's the tack that we're taking right now. We are not issuing citations, although we certainly could if it got to be that point. If you see something that you think is hazardous, like 911 hazardous, then call 911 and say, oh my gosh, this is really dangerous. But it needs to be an immediate threat to public safety. If you see a group, there are ways to report that. If it's an ongoing problem, we have an email that you could send to. It's called COVID-19 violations at mono.ca.gov. It's on the website here. You don't need to write it down. And let us know if it's an ongoing problem that you are aware of. But we are not taking a heavy hand on this. We want people to learn and to modify their behavior.
Thank you, Sheriff. Next question.
Why can you still book a room at Roadway Inn? Also, many rooms available on Expedia and Priceline, but more or less moving to June Lake.
Dan, do you want to field the hotel question?
They should not be able to book a room at Roadway Inn. We've put letters out to all of the operators of short-term rentals in Mammoth Lakes, and I know the county has done some outreach there as well. We definitely still have people who are in violation of that request. The actual violation isn't so much that you can't rent the room. The violation really is the governor's order and our health order that says those employees who support a hotel or work that way are not to respond to work. They are to be at home unless they are providing services to a certain group of people. If they are quarantined, if they're in isolation, if they are essential workers or emergency services type personnel, then they can be actually in a hotel. They can actually rent a room there and have those services. However, to be open and actively advertising and not providing those levels of service, they should have nobody at the hotel. Nobody should be there to answer the phone, frankly, or to provide any type of room housekeeping services. We have set up an agreement with Sierra Nevada Lodge or Sierra Nevada Resort and Spa to provide that type of housing at a discounted rate. If somebody is homeless, if they are in quarantine or isolation, we can provide those services at a reasonable rate or at cost, or even subsidize it as need be. They should not be renting. Those advertising through the internet, Expedia, or other Airbnb, etc. Again, we can't tell them they cannot advertise. We have asked them to block their calendars out that show no availability through the end of May. It's very frustrating because a lot of people have not gone in and changed things, or they are still actively recruiting people to come to Mammoth Lakes. We have pushed on that, and we are looking at options. Be before town council next week, frankly, looking at ways to either cite people doing that with a fine, or to actually eliminate their ability to rent short-term rentals for up to a year.
Thank you, Dan. Next question.
Will you update us when there is a test available for antibodies so we can come and find out if we've been affected?
Dr. Boo, do you want to take that question?
Sure, we'll make that information available as soon as it's fact. Yeah.
Okay, thank you, Dr. Boo. Next question, please.
Is it legal to park your camper on Sherwin Road and spend the night?
Sheriff Braun, would that be a question you could field?
Sure. Dispersed camping is still allowable. So if it's not a developed campsite or a developed recreation area, then people can still camp there. So not in a campground, but if they're off the road and on a dirt road somewhere, then that is still allowable, yes.
Thank you, Sheriff. Next question.
There are a lot of people coming to the end of Old Mammoth Road for walks and skiing. Some are respectful of keeping the 6-foot distance, but a lot of younger folks are not. Can you please post a big, huge reminder sign to people to be cognizant and careful, especially for us older folks?
Dan, do you want to take that question?
Yes, thank you. We've been working with the Forest Service in those areas that have their property there, and two different issues for those types of areas. One is, yes, we're looking at better signage. We've developed some options to put out already. It's a matter of getting them printed and making them stable enough so they can survive some of the weather we've had recently. But to remind people of the social norms that we're asking to be followed in terms of having your face covered, staying 6 feet apart, you know, all of those different things that we're pushing through the community. The next step in looking at some of those areas is a lot of those areas are very limited in their parking capabilities. We've actually looked at trying to reduce the number of people going to popular hike areas by limiting parking. It's kind of a dual-edged sword. It tends to push people to other areas, but if we can disperse them out more than what we have in some places, I think that helps with that same message of twofold. One, stay home, you know, go out and get some exercise, but, you know, do you need to go out in a large group and go hiking? Probably no. The idea would be, again, to push those same issues of stay apart, stay covered, and frankly, stay at home.
Thank you, Dan. Next question, please.
Is there any update on the status for opening season of fishing? Fishing should be at least, it moved. I'll leave it there.
I can answer that. So there was scheduled an emergency meeting for the Fishing Commission this morning that did not happen due to technical difficulties. They were not prepared for the number of people that signed on to their webinar, and they weren't able to mute them, and some people were less than appropriate for a webinar. We'll leave it at that. There's a misinformation campaign going around the state that this is an attempt to close fishing throughout the state of California, which understandably has a lot of people upset. What has been asked is Inyo and Mono counties have asked for a delay of fishing season opener. And to get that delay, they either need Fishing Commission approval, or we need the Fishing Commission, what they're trying to do, get the director of the ability to make that decision on his own. So that will be decided next week. Fishing opener isn't until the last Saturday in April, so we've got a couple of weeks on that. So we're still waiting to find out what will happen. We have asked, as has Inyo County, for it to be delayed, because to have a couple thousand people come into our county with nowhere to camp, nowhere to rent a room, nowhere to eat, nowhere to do anything really, would just create havoc. In our hospital, should any of those people get sick, ill, injured, that would just be too much for us in the midst of this crisis.
Thank you, Sheriff. Next question, please.
Has Mammoth Hospital been able to obtain adequate number of ventilators now that California is shipping many back east and to Nevada?
So currently we have 4 ventilators. We just obtained another potential ventilator that we are now assessing to make sure it can work. So that gives us a total of 5. Adequate ventilators is a relative term. Depends how many people come in and how many of them are sick. If we are following all of the social distancing and all of the different measures we are trying to do to counter this and prevent a major spike in the patients we're going to see, then yeah, we have enough ventilators. This is a small hospital of 8,000 feet, so respiratory illnesses at where we are at 8,000 feet is very difficult to treat. And for that reason, never mind this pandemic that we're dealing with, those patients frequently get transferred out because this is not an ideal place to take care of them. So imagine even if we have 7 or 8 patients in that condition and every other hospital that we refer out to is also full in dealing with this, which many of them are, we're going to be in a situation where we have no choice but to try to do the best we can in less than ideal circumstances to take care of them. So having a ventilator is not the end of the story as far as taking care of people in this situation. It's one of the tools we have, but ideally you do not want to get a respiratory illness to this severity in the climate we live in.
Thank you, Doctor. Next question, please.
Is it okay to still have outside recreational activity with our family? We are all being socially responsible. However, there is a noticeable concern by others in the community when partaking in outdoor activity.
Dr. Boo, do you want to field that one?
Yeah, I can imagine that it's hard for people who see you out as a family recreating to know whether you're a family or whether you're, friends interacting. But if you live together as a family, I don't see any harm in going out for a hike together or something like that.
Thank you, Dr. Boo. Next question, please.
Considering there are only 17 beds, 4 ventilators at the hospital, it seems that we could never safely get back to normal here without a vaccine. Is the hospital doing anything to expand capacity?
Dr. Burrows?
So we have expanded capacity. We can handle, and handle, I'm going to say is a relative term. We could admit upwards of 40 patients right now, and we could even expand up close to 100 if we had to. We have some creative solutions to do that. I don't know that I agree that a vaccine is the only way out of this. As this virus makes its way through our community and our population, people are naturally going to develop an immunity to it. And it's just a question of how fast is it going through our community. It's not very different than the idea of a fire. If you have a wildfire that's totally out of control, it's going to burn thousands and thousands of acres. If you get the fire under containment, yes, it's going to do some damage. It's going to burn, but it's going to burn in a rate that you can handle it, stay on top of it, and control it.
Thank you, Doctor. Next question, please.
California seems to be setting up for more and more rapid testing. Will Mono County be a part of this, or are we getting forgotten because we are more isolated?
Dr. Boo, do you want to field that question?
Yeah, so there's different types of testing, different types of rapid testing. The thing that I think is most interesting to us is rapid PCR testing, testing for the presence of the virus right now. The antibody testing, there's still too many questions about how useful it's going to be in the acute setting. It'll probably be more useful in terms of trying to, like Dr. Burrows just said, as some people are getting, infected and become immune to it now, we'll want to be able to try to sort that out later. But right now, the only rapid, and as Dr. Burrows said, the hospital will, within the next couple of weeks, have some ability to do rapid PCR, polymerase chain reaction testing for active disease. There's other things that that you read about, like the Abbott product that's come out, which I don't think it would offer any real advantage to what the hospital can do, except it might be more mobile. We might be able to do it in the community, but those are in short supply right now, and we've put our name on the list. But like you said, not sure how they will prioritize those. Probably larger population areas first.
Thank you, Dr. Boo.
Can I
Next
add something,
question.
Brian? Is that okay?
Absolutely.
Thank you. So, yeah, rapid testing seems very appealing because you get an answer quickly. The reality is that the treatment for being infected is still going to be the same, whether you know the results of the test or not. The first response is going to be, we're going to try to take care of people that need to be admitted to the hospital. So if you need to be on oxygen, if you need to be treated for different conditions or things that are not going well with your overall health, the results of that test is not going to change how we manage that. Truthfully, if you're sick or you're symptomatic, the recommendation, whether we know the result or not, at least up front, is going to be, look, you've got to stay isolated. You can't infect other people. One of the things that I think we need to take going forward from what we're learning about the COVID or the coronavirus pandemic is that's the way we need to treat things like the flu as well. The flu is very contagious. And typically, I think we've gotten used to something that we just are more comfortable with, to say, well, if I have the flu, at least I know it, and I'm going to be sick for a few days. But all the same practices still apply, which is, look, you need to take yourself out of commission for a while. Don't go to work, don't go to school, don't spread this, cover your mouth, stay away from people, give yourself a chance to get better. Don't have a fever for 3 days, don't be coughing, don't be symptomatic, and then go back out to work and school and hang out with your friends and family. It's the same application, it's just got a different name. Instead of influenza, it's called coronavirus.
Thank you, Doctor. Lauren, let's take a few questions from the phone line.
All right. Phone number ending in 4508. Go ahead.
Hi, my name is Shannon. We live in a tourist community, and most businesses like mine rely entirely on visitors. News reports talk about restrictions around the nation loosening around May 1st. With the information you have now, do you think June 1st is a realistic date to welcome tourists back to Monroe County? If not, when do you estimate we will?
Dr. Boo, do you want to take that question, please?
Was the question May 1st? I didn't quite hear that. But the answer is that this is a statewide stay-at-home order, and we'll be following the orders of the governor.
Thank you, Dr. Boo. Next question.
Next question is from Laura. Go ahead and unmute yourself.
Hi, it's a similar question. Do you anticipate changing the lodging restrictions from May until the end of June? And if so, would you do it regardless of what the governor says? And how would you enforce that?
Dan, would you like to take that one?
I'll take a shot at that one. I think the whole issue on when we can kind of recover and go back to whether it's visitors coming to town or getting our restaurants opened is really going to be driven by good science and what's happening to our community. If the governor was to lift that order and we still had a large population that was sick or ill or in our hospital, then we would look at our local order and say, let's hold off on opening our town up, one, bringing people in to be sick and or to extend the spread of the disease. So ultimately the governor's order does control us, and so we have to obey that and follow through on it. But I think in terms to be able to open our community up, I think it's going to be a number of things. What is the level of that activity in town in terms of the disease itself? Then what type of mitigation measures do we continue to impose? I mean, you could look at a lot of different things in other countries that are going on, whether it's hand washing or whether it's like we started, you know, restaurants can only be half full. You could come up with a lot of different things that way. But to say that we have a hard date at this point, I think is very, very difficult because we just don't know kind of what the next couple of weeks will hold, how you know, the rest of our communities are going to react. For Mammoth Lakes, frankly, I take a hard look at what's going on in Los Angeles and how big of a problem they have and how could that migrate into Mammoth Lakes again, even though we're doing extremely well, at least today. And so the enforcement would be another challenge. That would be both, you know, frankly, a lot of that within the town would fall on our town staff and maybe even our police officers if need be. And then throughout the county, some of the same issues of putting people on notice. And again, our main goal on that is voluntary compliance, because we really do want to keep people safe, whether they live here, whether they're visitors to here, and all of us who live here. We just, that whole issue of our public health and safety should really take a priority.
Thank you, Dan. I believe Chief Freebo would like to comment as well. Go ahead, Frank.
Yeah, it's a great question. It's obviously one that's on everybody's mind. I was on the phone today with Tom Parker from the hospital, and obviously we work daily with the public health officials as well. I know everybody wants to look at a calendar and start putting an X in there for planning purposes, but that's not the way this works. You've got highly talented people here. They're following national standards and protocols. We've got to let the clinical side of this be well-defined so we understand exactly what's going on in the community, set thresholds for activity that makes sense, and then link that up to the economic side. We know we've got to get back out of the position that we're in now. But if we do that too soon, if we get premature about setting dates, irrespective of conditions, it's the surest way for us to have a secondary wave that would put us right back in the position that we're trying to get out of. So you've been patient, you've been hugely helpful. Our mobility scores are back up to an A-. You heard the sheriff talk about the reductions in travel. You can tell that it's quiet in town. We do have a plan to return us back to normal, but the plan and the clinical side of this has to be the precursor, and we're working on those now.
Thank you, Chief. Next question, please.
Can I add to that, please?
Oh, sure.
So as Chief Freebo said, and I agree completely, I mean, the reality is that as a small isolated community, what we do on our own, if we stay closed, is one thing. I mean, we can control ourselves a whole lot better than all of our visitors. And I agree, we all need our visitors to come back. That's why we're all here for the most part. And speaking for the hospital, that's one of the reasons we're as successful as we are. But we're largely connected and dependent on how the rest of the state, if not the whole country, is doing as far as how fast we can open things up. So if we're doing great, that's one thing. But if LA County and San Diego County are still rampaging with this, and then we open our doors and they're looking for a place to go where it's safe and quiet, and wouldn't that be a nicer place to be than where we are right now? We could be facing a surge a couple months from now, despite all our best efforts.
Thank you, Dr. Burrows. Next question, please.
Next question is from Craig. Go ahead, Craig, and unmute yourself.
Yeah, let's see. Hand sanitizer has not been available for over a month, and the ingredients are also not available. So rubbing alcohol has been out of supply in town for over a month. Aloe vera is generally available, but what's needed is alcohol. We have 4 breweries in the county. We can flood the county with hand sanitizer. However, when I've talked to the breweries about making that available, they direct inquiries to the county health department. And the county health department has not responded to this question. So my question is, why can't we get high concentration ethyl alcohol, namely alcohol concentration of 70–90%, which is necessary store-bought alcohol, gin, vodka is not high enough proof. Why can't we get either the ingredients or the finished product, given that we have massive production capability here?
Frank, do you want to field that question?
I don't know if I can answer the whole thing, but I can tell you that I'm familiar with at least one distillery in town that's been doing this for the better end of 3 weeks. Brian, I know you deliver it on a regular basis. The Devil's Creek Distillery has done just that. I think that we're one of the first ones I heard about in the nation doing it, actually. So I know that it is being done now. It has been getting done. So I'm not sure I can answer why there's a disconnect between the breweries. It may be a different process, but I know that at least one distillery has been doing that in very large quantities for about 3 to 4 weeks.
And then I can also speak to that. So yes, Devil Distillery has been giving us a supply of their hand sanitizer they're producing. And that has primarily been going out to the businesses in the community that are running to help protect not only those members of the business, but the public that is seeking those services. These businesses are such as restaurants, the hospital, and also grocery stores. So that's primarily where the hand sanitizer from Devil's Distillery has been going. As far as the other distilleries, I do not know if they're producing. Next question.
Next question is from Ryan. Go ahead and unmute yourself.
Yeah, I was just going to add to that. Shelter Distilling has finally got the materials in place to also create the sanitizer, and they're producing that and providing it to the hospital. But to the gentleman's other question, it's not the breweries that can make the sanitizers. It's only the distilleries that can do that. We only have 2. So.
Unfortunately, we still have plenty of soap and water.
Thank you, everybody. Next question, please.
Next question's from Juliana. Go ahead and unmute yourself.
Thanks for doing this, first of all. I live in LA and I have a house in Mammoth, and our lease is ending soon, and we need to get gear and things out of the house before giving it back to the owner. I was wondering if it's safe for me to drive up, provided I bring food and don't have any contact with anyone in Mammoth.
Dan, do you want to take that question?
Yes, if you have a long-term lease on that property and you need to come up and address that issue and pick your stuff up, and understanding that may require you to spend the night here, that's more than legal. I mean, you're not coming up and renting it for a night. You're not doing the short-term rental issue. You are coming up to address your personal property. And we really don't want to keep people from doing that. If you're asking, can I come up and hang out for a week and play and go, goof off in the snow, et cetera, we might push back much harder. But to come up, get your property, clean your house out, let your lease expire out, so you're not caught in between in a bad way from that perspective. Yeah, you are welcome to do that. There is no, as mentioned earlier, there's no stop on the road there to check you out, but that would be an acceptable process to take care of your expiring lease.
Thank you, Dan. Just as a reminder to all of our participants and attendees that we have 15 minutes left in this meeting. So let's proceed ahead with the next question.
Will there be routine testing at some point for essential service workers so they do not expose colleagues, community members in the process of their essential work?
Dr. Burrows, would you like to field that question?
Sure. So that is really a whole process that we've been giving a lot of thought to, and not just me or Dr. Boo or really anybody. This is a world problem with reality of how to roll everything out to get us back to normal function. As more testing becomes available, and there are proponents to say we have no reason why we shouldn't make millions and millions of tests available, then it becomes more of an opportunity to identify people who are infected, who have been in contact, who are at risk, and then we can isolate them appropriately. The antibody test that Dr. Boo referred to earlier is something that becomes another piece of equipment, if you will, to try to figure out who's immune and who's been exposed and is no longer at risk. The antibody test is still something that's intriguing. It's not really ready for us to have out and available as much as everybody wants and as much as the media makes it seem like it's readily available and we should just do it. But as all of those pieces become more available in bigger numbers, that absolutely is going to be a part of the strategy of how we identify people and get people back to work and not put other people at risk in doing so.
Thank you, Doctor. Next question, please.
Sounds like the mountain is going to be closed till next winter. How will this affect the economy in the town?
Dan, do you want to take that one?
Sure. Thank you. We have not had confirmation from the mountain that they will be closed until next winter. I think the last discussions, at least that I've had, that they were still looking at options for a portion of the summer and how much of that activity may or may not be doable this year. But regardless, it definitely will be a slower process and slower opening, just given where we're at today. The impact on the community throughout the summer and into the fall will be fairly substantial. We're assuming if the mountain chooses not to open, we'll still have people coming up and doing things. If they're prohibited from opening because of the virus in the community, of course, that's a larger question. At the town level and ultimately into the county, we're doing a lot of financial work, trying to get a handle on what we think the impact economically or financially is going to be with or without the mountain opening. I think we're going to see a fairly significant impact in the short term regardless. But if it stays closed, there's multiple impacts, one just from a visitor attraction, from employees, and from just the operational side of what that does, putting money into our economy. So it will have a significant impact.
Thank you. I believe I have two panelists that would like to add to that. First, Chief Freebo.
Again, I want to go back to something that a concept that we presented earlier, that trying to figure out when things are going to open. Obviously, it's on our mind. This is a tourism-driven economy. We know that. We know that we're being hurt economically, and we may be hurt a little bit longer. These things do pass. We have solid histories of them. They do come. They do what they do, and they go. So we'll get through it. That said, I really want to tip my hat to Mammoth Mountain. They're taking a financial hit too, and their ability and willingness to ride this out with us is probably one of the things that's going to help us get back on our feet. So we're in this together. And again, I really want to thank them for supporting this community best practice for our own good for the long term.
Thank you, Chief Freebo. I believe our CAO, Bob Lawton, would like to add to this. Go ahead, Bob. Bob, are you there?
Brian, I was ready for a different question, so.
Oh, I apologize. Then we will just move on to the next question.
Are property taxes still due tomorrow?
I believe that's the one for you, Bob.
Yes, and I have the great good fortune to report, yes, they still are due tomorrow. Property taxes are an important part of revenue for the town, for the county, for our school districts, and the April 10th deadline has not been changed by action of the state. There are certain provisions by which fees and penalties may be waived, but they generally require, they're not waived in the case of inability financially to pay, inconvenience, or other factors other than a literal inability to pay because the property owner is physically ill with no one to make the payment for them, that the office, the treasurer's office, would be closed, which is not the case here in Mono County. And if for whatever reason the taxpayer were not able to access any kind of electronic or online payment or transfer systems. So unfortunately, for some folks, the deadline has not been extended, and we do rely upon prompt payment of property taxes.
Thank you, Bob. Next question.
What about face guards for skiing? Many people have them. Are they appropriate for facial masks?
Dr. Boo or Dr. Burrows, would you like to field that question?
Sure. The general sense is that any face covering is worthwhile. Some are better than others. Use what you have.
Thank you, Dr.
I
Boo.
would agree with Dr. Boo that something is better than nothing, absolutely.
Thank you, doctors. Next question, please.
Is it possible to send out a community reminder about Hantavirus? I imagine a lot of people are doing home projects / spring cleaning during this time.
Dr. Boo, do you want to take that question?
Sure, it's a good idea. I was thinking about Hantavirus myself this morning. Yeah.
Okay, next question, please.
Is new construction essential?
Dan, would you like to take that one?
Yeah, we get that a lot of people out working and doing things. And bottom line, in the governor's order on essential services, there is language dealing with construction kind of broadly, and then very specifically for housing. So at this point, the way that reads in the review from the attorney's side is that new construction on facilities, be it a business or homes or other specialty work by a plumber, electrician, et cetera, are all allowed underneath the governor's order.
Go ahead, Frank. I know you wanted to comment on this as well.
Yes, well, it may be an essential service. They're not relieved from exercising the public health requirements that we put out. So on the webpage, if you see some activity in construction or in any other setting that, Sheriff Braun said we can't keep people from everything that they may do, but we have taken complaints from some utility work, some construction work, where people are not practicing those public health orders. You can dial into the EOC on that, and then we'll send some folks out to do some on-site education.
Thank you, Chief. Next question.
What was your opinion of the New York Times article?
Dr. Boo, go ahead.
I thought it was a good article. It was a little bit dated. She did the reporting, a week and a half, 2 weeks before the article appeared, and the situation is changing rapidly. I think it accurately reflected my views and the facts at the time.
Thank you, Doctor. Next question, please.
Who do we call if we see kids using the skate park?
Dan, would you like to field that one?
They call Lauren, who's doing our call taking. No, they can utilize the skate park. Again, it's not that's an exercise. They can go out and do some of that. I don't think we've closed the skate parks. We've closed some of the playground areas. The issue there just becomes back to the same thing that we've hit hard on tonight is, are they respectful of each other in terms of distance? Do they have their face covered? Are they being responsible for those activities? But I'd have to defer to some other folks, but I don't believe we've actually closed the skate parks for activity. Similar to our trails in town, the MUPs, the multi-use paths, people can utilize those. They're not a closed facility. But we do request that people manage their interactions.
Thank you, Dan. It looks like we have time for about one more question, so go ahead.
What can we do about encouraging the rest of the community to start wearing masks when going out in public places?
Chief, do you want to take that one?
So part of it is, as we've said here tonight, you can make, any covering is better than none. I know my wife and I were ordering some bandanas online, and those are coming up a little bit short. But you can make them out of just about anything. Something's better than nothing. That said, between Unified Command and some of our other resources, we are looking to put additional orders in for combinations of face coverings that are made locally for surgical masks and for N95s. The supply chain for those is starting to catch up a little bit, but we're making some assessments now that may allow us to provide those through those resources on a broader scope through the county.
Thank you, Chief. Would anyone like to add to that?
I'll just add that a mask that you can make or sew, and I've posted a video on the Mammoth Hospital website on literally how you can make a mask in a minute without having to know how to sew. But something to that effect that you can wash is going to be something you can use over and over again. The problem with the disposable masks or the surgical masks or the N95s like we're using in the hospital is they have a limited shelf life. And for the surgical masks in particular, once you use it once, that's pretty much it. You can't keep using it over and over again. It just wears out. It doesn't hold up. But a mask that you're sewing or making that you can wash is something that the next day it's ready to go and you're not burning through resources anymore.
Thank you, Doctor. And I'd like to thank all of our panelists tonight. Unfortunately, this is all the time we have for this community meeting. I hope you join us again next week for further updates. Until then, take care of yourselves and each other.